The final rites for those whose deaths have been COVID-19 deaths have been extremely difficult for families, especially those who have lost more than one member, and the stigma that family members face makes it even more devastating. This, the Ministry of Health says, is breeding an unholy union between doctors and affected families.
This has been brought to our attention by the doctors themselves, especially those apparently in the private sector, who are undermining the process of protecting families by exploiting their emotions and colluding with some of them to ensure that burial rites are observed normally. Some go to the extent of denying valid positive results to family members of people who die from COVID-19 complications with deadly consequences.
Experts have warned that when a person succumbs to COVID-19, they do so at their most infectious state, shedding the virus at high levels, and therefore, when buried as regular fatalities, without the protective measures in place, everyone that is in that environment is exposed. As such, the ministry now wants health officials to initiate posthumous testing, where and when there is a difference in opinion regarding the cause of death, to minimize the risk of exposing others to the infections.
If your relative, if your brother, if your sister, if somebody succumbs to COVID-19, let's just be honest, anybody can die of it. And there should be absolutely no reason why a doctor should issue a negative certificate to a positive death.
There's nothing wrong with culture. But times are abnormal. So we must change the way we bury our dead.
Given that 763 health workers have contracted the virus and 14 have died, the Ministry of Health is urging county governments to purchase the best quality PPEs that meet the best quality international standards to minimize the risk of exposing the frontline workers.
Doctors, please protect yourselves as individuals, even as we at the Ministry and county government strive to protect you by providing PPEs.
In the meantime, Kenya recorded 1,062 recoveries, the highest number ever recorded in a single day, bringing the total number of recoveries to 12,961, 79 from health facilities and 983 from the home-based care program. 599 infections were recorded, bringing the national caseload to 26,436. 2 deaths were recorded, bringing the total fatalities to 420. Dorcas Wangira, Citizen TV, Nairobi.